So today is the big day. Going to test out the knee on the tennis courts. As you remember from the previous video, I did the bike ride last Thursday, and no pain in the hip, no pain in the knee. So fast forward to Tuesday, and it's not really a match. It's kind of like a round robin type thing, just to play in between the spring and fall seasons. So I'm going to jump in here with the guys and test out the knee, see what it feels like, and get back with you after the match and give you an update on it. So wish me good luck. Here we go. Thoughts about tonight? Nothing hurt. The knee was fine, the hip was fine, but I guess it's going to take a while to get used to. It's just an odd feeling. The hip feels pretty much like a normal hip. There were certain movements I did, like lunging or planting, a quick plant on the left hip, left side. It just felt kind of weak. It hadn't been that long, and the doctor said it takes up to a full year to get your strength back. So I don't think it's anything to be concerned about. The knee, once again, I just think it's weak. When I tried to push off, like for a drop shot at the net, you try to push off to sprint to the net. There wasn't much to push off on, and didn't hurt, but it's just an odd feeling. So I'm hoping that it's just weak. But overall, nothing hurt. That's the good thing. No pain in the knee, no pain in the hip. There's a little pain behind the leg, but I think that's just from probably overdoing it a little bit. But I can tell it's swollen a little bit, but just a little soreness behind the leg, behind the kneecap back there. So go home and ice it down. Hopefully it'll be okay. This is the day after the tennis match. I just wanted to show you guys my knee, and as you can tell, it's a little swollen, but from what the doctor tells me, it's going to be swollen anyway. It's always going to be a little bit bigger. It's always going to be a little bit bigger than the good knee, so that's kind of normal. But doesn't hurt. That's a good thing. The only thing, there's a little bit of soreness on the back side back there, below the knee, around the back side there. It's kind of tender. It's not like a sharp pain or anything, just like a little nagging pain, and I'm sure that's just from stopping and starting, turning, twisting on it. The knee hasn't been through that in a long time, so, and from what I'm told, it takes up to a year to fully heal. So it's only been a little over 4 months. So yeah, it's still fairly new. So I guess the soreness is expected, but overall, the knee doesn't hurt, man, and the hip held up, so I'm happy. It's all good. Things are rolling along. If any of you out there are thinking about possibly getting your hip replaced or your knee replaced, there's some things to consider. Be committed to rehab. They'll give you a lot of little exercises to do, and they may seem simple, but if you want to get back, to where you were, you need to do these exercises. One of the main ones for the knee, it was, after surgery, your leg is kind of bent, it's not fully extended. So one of the main things to, fully getting back is having extension with that leg. So they'll tell you, like, if you're sitting down, to put your leg on the edge of a table, extend your leg out, let it hang on the edge of a table, and at first it'll be kind of hard, and you'll let gravity kind of do its thing as far as your leg coming down. And as your leg gets stronger and the pain kind of subsides a little bit, you'll be able to put some weight on your knee to force your leg down to get that extension, So that's very important, along with a lot of other little exercises they give you to do. The hip, the surgery itself, it's not that bad. You'll hurt for a few days. I think I was off crutches in about 5 days. You're hopping along, but you got to start walking and get your strength back. The knee is another story. It's a little bit more intense. I'd say it's pretty painful for about 10 days. Yeah, it's pretty painful. Um, the worst part was trying to get comfortable at night, trying to sleep. That's what bothered me the most. I didn't get a lot of sleep, so for 10 days I was kind of, miserable. But after that, things start clearing up, pain starts going away. But I will say, I'm a person that really doesn't like to take medicine unless I absolutely have to. The pain meds that they give you to take, don't make the mistake that I did and take it when you start feeling pain. They'll prescribe it for you and they'll say, take this pill every 4 or 6 hours, whatever the case may be. And you want to stay on schedule with that. Even if you're not feeling pain, you want to go ahead and take the pill. Well, I made the mistake of, trying to be the tough guy and not take it until I felt pain. Yeah, you want to take it. It takes a while for the medicine to take effect, so you're kind of feeling that pain until it does. So that's very important. But if any of you out there thinking about having either of the surgeries, hip or knee, you just gotta. Everybody's different. In my case, I went to a couple of doctors, and one doctor said that I'll be 55 this year. He said that he wanted me to wait until I was 60. That way, chances are they wouldn't have to go back in to do another surgery. Well, I wanted to be active now. We'll worry about that later. So there's nothing wrong with that. But if you're an active person, chances are, you're gonna probably wear the knee down and have to have another surgery. So that's just the route I took. I'm happy with my decision. I haven't been able to pretty much do anything athletically in 2.5 years. So now having that back, it means the world to me. So I'm happy. I'm happy with my choice. So those are just some things to consider. So my next big goal is there's an annual event. It's a bicycle ride that benefits hospice. It's a 65-mile ride, and from day one, when I had the hip done in January, that was my goal, because that's just an event I've done every year, and I always look forward to it. So that was my goal, to be able to do this event, and this year it's August 27th. So I've got just over a month to try to get my leg a little bit stronger and try to get some wind back and try to prepare for this ride. So that's my goal. I'm going to do it August 27th. So check back in then, and I'll try to post some shots of the ride, and then I'll talk to you after ride, and we'll talk about how the knee and the hip held up. So we'll talk to you then.